Let's take you live to the Western Cape now, and President Cyril Rampahosa today is visiting the province to assess the readiness of the response to COVID-19. President Ramaphosa is being accompanied by Premier Alan Winde and the Health Minister Dr. Cyril Rampahosa on his inspection of facilities. My colleague Ayesha Ismail joins us, and she's been following them throughout those visits. Ayesha, let's just perhaps replay the morning's events as they happened.
Well, President Cyril Ramaphosa, and as you said, along with Health Minister Cyril Rampahosa, was brought here to the Cape Town International Convention Centre by Premier Alan Winde to showcase the country's largest COVID-19 field hospital. It is a hospital now equipped with more than 850 beds, and I must say that the President was very impressed with what he saw here. He commended the Western Cape government as well as the health authorities here for what they've been doing so far to try and fight COVID-19 and to bring down the levels of infection. He also spoke to some of the health authorities here, and they were telling him about what they are doing and presented the program to him. However, they did also talk to the President and the Health Minister about the challenges facing the Western Cape government and the Western Cape health authorities. Now, it is important to note that at the CTICC, that has now been converted into a COVID-19 temporary field hospital, and this is CTICC 1. They're also talking about converting CTICC into another hospital with an extra 800 beds. And then, of course, there are 3 other field hospitals, one in Khayelitsha, one along the R300, as well as one in the Witzenberg area. But coming back to the staffing of all these hospitals, that was of a major concern to the health authorities, and of course of a bigger concern to them was of course the issue of budget, the issue of cost, and they spoke to the President about this and wanted to get an assurance from him that he will be making money available to this province to continue with the work that they are doing. Let's take a listen to what the President had to say in response to that.
Let me immediately say, as Dr. Rampahosa has said, the staffing challenges must be solved. We are at war. We are fighting a life and death war, and staffing challenges must be solved. We must identify, headhunt, and find all those staff members that we need to bring in. Cost is not the issue here. Saving lives is the main issue. And that must also apply here in the Western Cape. When I went to the Eastern Cape, they were running short of a number of health workers they needed to bring on board. We immediately said, together with Dr. Rampahosa, that they must go out and find those health workers so that we can manage COVID-19 properly. And similarly, I will say here, not having enough staff members is not going to be an excuse that I will accept. We've got to find them. Money is not going to be the issue. We must pull out all stops to save lives. This is a war that we must win. We cannot sit back and be defeated by COVID-19 on the basis that we didn't have enough staff members.
We are fighting a life and death war. What else did we hear from the Health Minister, Dr. Cyril Rampahosa?
Well, Dudu, also just to add on to what the President said, he did commit to making 3 billion rand available to the Western Cape. Now, Health Minister Cyril Rampahosa has been spending a lot of time in the Western Cape working and assisting the health authorities here. But one of the things that came up over and over was the shortage of beds. Let's take a listen to what the Health Minister had to say about the situation in the Western Cape.
The area that we had identified as needing a lot of strengthening in the provincial strategy has been the issue of quarantine and isolation. This is the area that I think we need to really make sure we focus on very strongly to ensure that we can cut the cycle, we can break the cycle of the infection. A lot of discussion has gone into this, and we have seen how various departments have come together, particularly public works, tourism, environment, who have offered additional beds so that we can actually reach the numbers that we need to take the people out to quarantine and isolation. This now adds on to what the provincial government has been doing. They took me around to show me some of the areas where people are going to be taken. I still think that we need more beds. I have said to Minister Delile, Minister Chrissy and Minister Kubai that we need to really push to up to close to 30,000 beds. The focus, President, has got to be on those who have turned positive in the past 2 weeks. That's where the large source of infection is coming from. So we are not only dealing with the positive cases, we're also dealing with the contacts. And so this is the area where we believe we're going to make a very concerted effort to reach out to breaking the cycle of the infection.
And of course, the inspection of the Cape Town International Convention Centre is not the last stop. Talk us through the rest of the program for the day.
Well, the President will be taken to a facility later this afternoon, and it is a project called the Red Dot Transport System. And of course, as we heard earlier about the number of healthcare workers that have been infected so far, and this is of great concern to the Premier of the Western Cape, to the President, and of course to the National Health Minister, who all three of them thanked the health workers for the good work that they've been doing, and of course putting their lives in danger to help save South Africans. And so this afternoon, this Red Dot Transport System is a system where health workers will be able to be taken to work safely and taken back home through this Red Dot Transport System. And then, of course, that the day will end with a media conference conducted again by the Premier of the Western Cape, the President of South Africa, and the National Health Minister, Cyril Rampahosa.